Can I start by acknowledging the traditional owners of the land on which we meet today and pay my respects to elders past and present and extend that respect to any Aboriginal people who may be with us in the room today. I've been asked to speak on the impact of the federal budget's measures on people with complex needs, so I take that as a bit of an open invitation. Basically to talk about the impact of the budget at large. But before I do that, I might start, given, as you've said, Melanie, that I'm a relative new bloke to the portfolio, maybe just say a few words about myself by way of introduction. I'm the federal member for Throsby, which is an electorate that is based on the southern Illawarra and southern Highland suburbs in New South Wales, just down the coast. I was first elected to Parliament in 2010. Before becoming a parliamentarian, I worked for many years in the community sector, including as a youth worker, as a worker with people with disabilities, including people with developmental disabilities. I was working for an organisation for a number of years in spinal cord, looking after people immediately post-trauma with spinal cord injuries. And working in the western suburbs of Sydney with disadvantaged youth. So the subject matter of today's discussion is not something that is a million miles from my past experience. After working in the community sector, I became a lawyer. I worked in a number of organisations. I worked for the ACTU for many years and worked in the public sector for a number of years as well. So. We all come to our offices with many years of experience, and I think that helps us focus upon the issues that are before us. I understand from the statement that you're also grappling, the statement that you've published before the meeting, that you're grappling around definitional issues. I, for one, don't think that this is a purely semantic exercise. In politics, as in policy, words matter a lot, and your ability to capture both the policy makers but the public imagination matters enormously when you're trying to address the needs of your client groups, particularly when you're trying to encourage government to work across policy silos to meet the needs of your client groups. Can I just say a few words about good policy and what that means to us at this point in time? I believe that to get good policy out of this Parliament and other parliaments, you need to be working with both good evidence, but also something that is often frowned upon. Whether you call it ideology or whether you call it values, I think it matters a lot. The important thing is that you don't use ideology to create the evidence. You use your ideology or your values to analyse the evidence and craft the policy responses. I think there needs to continue to be room in public life for the big ideas that grapple with the problems that we are facing as a society. We should not eschew the need for us to take on complex, if not ambitious, policy projects. And I point to the National Disability Insurance Scheme as one such big idea where government, working with the community sector, working with a fantastic campaign that came up with a great policy slogan, I've got to say. I think Every Australian Counts will go down as one of the great policy slogans of the last decade. I'd probably put it up there with Closing the Gap, a policy slogan which enables us to bring together exactly what it is we're trying to do and to use that as a way of gathering the public imagination and being able to force government to take the big steps that are needed in the interest of our client groups. I think both of those examples are also an important illustration that we can't just turn to government and say, we need you to take these big steps for us. We actually have to bring the community along with us. Governments come, governments go. But what we are seeking, particularly in the health sector, is enduring reform, things that can endure before the changes of government, beyond the changes of government. We can look back at examples where we've taken one step forward, two steps back. But I think by harnessing a popular idea with community support, we can see changes endure over the long term. We're about to approach the 40th anniversary of the double dissolution of this Parliament, which led to the first and only joint sitting of Parliament, which passed the Health Insurance Commission bills, otherwise known as Medibank. I think we all know the history of those reforms, where we saw a popular idea take one step forward, two steps back. But I think across all sides of politics now we see that, at least in name, the importance of a universal health system and the importance of an institution like Medicare is one that is well entrenched in the popular psyche, and we hope the other reforms that we as a party have championed over the last decade attain the same sort of status. We don't want to see us taking one step forward, two steps back with important reforms such as the National Disability Insurance Scheme. Can I turn to the budget and focus on a few of the issues that I think should be of concern to you and others? The government has relied on three mistaken beliefs to underpin some of the more radical reforms that they've introduced as a part of this budget. The first, and I want to go to the issue of what we're calling the GP tax, the co-payment, and a lot of the other associated reforms. The first false belief is that somehow as a nation we're going to the doctor too much. This was a statement built upon the report of the National Commission of Audit. You think if you had all the resources of government available to you and plenty of time to do the research, that you'd actually get the numbers right on this one. But the Commission of Audit came up with the extraordinary conclusion that on average Australians are going to the doctor around about 11 times a year. Now we know, of course, that that's not true. We know, of course, if you look at the right column, you look at the right material, the material that should have been available to the Commission of Audit and then the Treasurer who has been out there repeating these falsehoods, that the figure is closer to 5.6 times per year. So if you're going to base your reforms on data, you might get the fundamentals right. The second assumption that the government makes is that somehow if you don't pay for a service, you don't value it. And they've been trying to win an argument within the Australian community that because we don't pay for access to Medicare services, particularly GP services, we don't value it. Somehow we're encouraged to believe that people are trotting off to their GP because they want to catch up on backdated issues of Woman's Weekly or National Geographic, or they're up for a conversation, albeit a very short conversation with their GP. Well, frankly, I don't think that's the case. Firstly, we do pay for our Medicare services. It's called the Medicare levy. And I think of all of the taxes, hypothecated or otherwise, that Australians pay, I think this is one that has the most support. And you would recall when we were debating the National Disability Insurance Scheme, there was bipartisan support for increasing the Medicare levy to help fund in part the introduction of that scheme, and I think that underpins the fact that there is broad support for a universal tax, a hypothecated tax to fund something as important as the Medicare scheme. So I don't accept that people are going to the doctor because too much, and I don't accept that they don't value it because they're not paying for it. We are paying for it. And I think this is the second of the false assumptions upon which this policy is built. The third assumption is that somehow that the costs of Medicare and the PBS are spiralling out of control. You might have heard the health ministers, both the Minister and the Assistant Minister for Health, quoting the fact that 10 years ago we were spending $8 billion on Medicare, and today we're spending $20 million. It's actually 19, but let's not quibble over $1 billion. In relation to the PBS, the cost of the PBS has doubled, or close to doubled, from $5 billion per annum to $9 billion per annum. Now, this sounds, on first blush, fairly seductive and a winning argument. A massive blowout. Those figures have doubled over the course of the last 10 years. So I did some interrogation of these figures, and what I've been able to conclude is that we don't actually have a massive spiralling out. Yes, we do need to put in place measures, and I will argue that we have put in place measures. Some of them not popular with our GP community or the medicines community, but we have put in place measures over successive governments to maintain a sustainability in the Medicare benefit scheme and the pharmaceutical benefit scheme. But if you're going to get a true analysis of the costs of the MBS and the PBS and the Australian budget, the figure you should be looking at is the proportion of total government outlays. And if you look at the proportion of total government outlays over the last 10 years, you'll find this, that 10 years ago, Medicare spending was about 4.8%, 4.8% of government expenditure. If we have a massive spiralling in the Medicare benefits, you'd expect that figure to be maybe twice, 3 times of what it is what it was 10 years ago. In fact, it's actually decreased. So the proportion of Medicare benefits spending over the last 10 years has not doubled or tripled, as the Minister is trying to convince us. In fact, it was 4.8% of government expenditure 10 years ago. In today's budget, 4.6% of government expenditure. Now, I don't want to quibble over 0.2%. The point I make is it's remained roughly consistent as a proportion of government outlays over the last 10 years. In fact, that's a remarkable achievement, because we know that the cost of providing healthcare in this country actually exceeds inflation. So it's a remarkable achievement of successive governments that we've been able to keep the proportion of government outlays in relation to the MBS at roughly consistent levels over the last 10 years. And I make the same observation in relation to the pharmaceutical benefit scheme. 10 years ago, $5.2 billion and 3.2% of government spending. Today, $9.5 billion, 2.3% of government outlays. So, important figure. 3.2% of government spending 10 years ago, 2.3% today, close to a 1% decrease in government as a percentage of government outlays. So, in that one area, because we know that the cost of pharmaceuticals is increasing, way outstripping the cost of inflation, I actually say as governments, as a series of governments, we should be slapping ourselves on the back and saying, actually, we've done quite a good job, because every year, new and more expensive drugs are listed on the pharmaceutical benefit scheme. Never as many as the industry and the client groups ask us to. But it's actually a significant achievement that we've been able to manage an important, albeit expensive, area of government revenue, and to ensure that, far from increasing as a proportion of government outlays, it's decreased as a proportion of government by close to 1% over the last decade. So I use these 3 points to argue that the government has actually put the ideological cart before the evidence horse as an attempt to justify its flagship changes in the area of health portfolio over in the 2014-15 budget. So what does the budget mean for people with complex needs? Look, there's a lot of other changes that I think we should be concerned about. I've spoken at great length about the changes to the Medicare scheme and how they're based on some false premises. We can talk some more about the impact of the GP tax, particularly on people with complex needs. the fact that that is likely to, and every doctors' association, every healthcare professional that's made public comment on this has condemned it and has said that it is going to impact adversely on people with disadvantage, people with complex needs, people in regional Australia, and this is an idea that needs to go back to the drawing board. I would add to that the $55 billion worth of cuts to public hospital funding as a significant problem with this budget. It takes a lot to get state premiers of the same political persuasion as the government to come out and condemn, consistently and persistently condemn a Commonwealth government measure, and they have done exactly that. Last week, the Treasurer of New South Wales, the Liberal Party Treasurer of New South Wales, Andrew Constance, said, "We cannot beat around the bush. This is going to hurt patients in New South Wales." The Premier of Queensland has made similar observations. The Premier of Victoria has made similar observations, and they are right. The significant problem, a significant problem that I have with the $55 billion cut to hospital funding is that it does not stand alone. In tearing up the hospital, the National Partnership Agreements and the Health and Hospital Funding Agreement, what the government has done is basically turned its back on what was a bipartisan position for over a decade, and that is that we need to work together and bring the areas of acute care, that is hospital-based care, and primary care, the care driven by GPs and allied health professionals and healthcare within the community. We need to work together. We cannot have the Commonwealth going off and ignoring the needs of the hospital sector, which is effectively what the government has done. By tearing up this agreement, we need to work together in these two areas of care. It's been a bipartisan position for well over a decade. The Commonwealth has effectively turned its back on that position. And the $55 billion cuts in hospital funding is only a part of that. I've talked about my concerns about the lack of a factual basis in relation to the PBS. Last week, the government introduced the bill into the House, which will increase the co-payments for the PBS scheme. The part of that initiative which has attracted less attention is the indexation of the PBS safety net and the significant increases that are going to be put on the threshold that people need to meet before they can have their additional pharmaceutical expenses met through the PBS scheme. So more out-of-pocket expenses for people with high needs who are relying on PBS payments and assistance. So these three areas, the GP tax, the cut to hospitals and the changes to the PBS scheme, which I think are going to have a significant impact on your client groups. But in complex needs, it's not simply the cuts to one portfolio, as I think this organisation is doing a very good job of advocating. It's joining up the policy initiatives of a range of portfolios. So when we look at the changes in the social welfare system, particularly in an area such as mine, a regional area with very high levels of unemployment, particularly youth unemployment, introducing a mechanism which is punishing people for losing their job and denying them access to benefits if they do lose their job is going to have far-reaching social consequences that I do not believe have been contemplated by the government and the ministers when they introduced it into the Parliament. And my party, for one, will be opposing this in the House, in the Senate. This simply cannot be allowed to occur. Putting somebody off benefits when they lose a job is just going to compound the disadvantage and the difficulties that they are facing. Whether it's access to healthcare, whether it's access to basic services, is going to compound their disadvantage. The other issues that I'd like to focus on in the time remaining, the changes to the education system, whether it's the vet sector or the higher education system. I think these are of concern to all of us by putting more obstacles in the way of people entering or seeking to enter the higher education system, I think, is a retrograde step. I focus on people of similar backgrounds to me. I've done 2 degrees. I entered the workforce. I wanted to retrain as a lawyer, and I know that there are many people who enter the university sector well into their 20s or early 30s, or maybe in their 40s or 50s. And if they have to contemplate paying off excessive university loans, paying back excessive HECS debts at the same time as paying off their mortgage, meeting the needs of their family, what it simply will lead to is people not re-engaging with education. They will simply not be able to afford to retrain. And this is an issue which I think should be of concern to everybody. We know that the old pattern of having a job for life, something that might have been enjoyed by our parents or our grandparents, is something that is not going to be enjoyed by ourselves or our kids. If we are going to ensure that people are not marginalised from society, we're going to ensure that people have access to the education and training that gives them an opportunity to get back into the workforce after a change of employment or a loss of a job, then unfettered access to higher education has to be a part of that mixture. I'm concerned that if I keep talking, I may not leave enough of my residual voice to answer any of the questions that you have. But I do want to make this point in conclusion, that a budget is not just a set of numbers. It's actually a statement of a government's values. And I think what we have seen in this budget is the government expressing a set of values which are out of step with mainstream Australia. I think for decades, successive governments have understood that if you're going to make major changes, not only have you got to prove the case that they are necessary, but we are going to do enough to ensure that there is fairness and equity in those changes. An observation made by John Howard himself in a National Press Club address not 3 weeks ago. You've got to bring the community along, and they've got to believe that those changes are fair. And I think on both measures, the government is struggling, if not failing, in convincing the Australian people that these changes are both necessary and fair. Thank you for your time this morning.